Hello, Dr. Chad Williams here. Happy to give you folks a bit of a virtual introduction or tour to the Dartmouth General Hospital endoscopy space. Brand new state-of-the-art facility over here we're really proud of, and offering great care to folks in need of endoscopy care in Dartmouth. So this is where folks come in initially. So as you can see, this is the front desk where they meet a clerk. This is after hours, so obviously not very busy at all right now, but usually quite a busy spot. These are the waiting chairs. Some of them, as you'll notice, are taped off and not being used right now, but those that's because of COVID precautions, which we'll be lifting in the weeks to come. So come along and I'll show you through the rest of the area. So this is the intake area and also the recovery area, split up into two sides. So this is where folks come in, they get changed into their hospital clothing here, and then we'd get them ready with any equipment that they need, such as intravenous insertion, and then they wait here until they're ready for their procedure. And I'll just walk you over here. This is the nursing station, so the nurses are able to see all of the patients from this station. Over on this other side is the recovery area. Once patients are done in the procedure room, they come out and they recover here prior to going home. Okay, so let's have a look at one of the actual endoscopy suites. Come along. So we have 3 endoscopy suites here at Dartmouth General Hospital. The third room has graciously been the benefactor of the donors, of course, and we're very happy about that and very grateful for that. And really, that third room is going to be the workhorse for the colon cancer screening program. So that's awesome. It will save a lot of lives. Just to show you a bit of what the equipment's about. So we have a high-end, high-tech endoscopy tower here attached to one of our endoscopes. There's usually a lot more tubing set up, but after hours we've taken most of that down. And this is all hooked up to one of our magnificent screens here. So high-definition screen allows us to see in great detail what's going on at the level of the mucosa. So, for instance, we're able to see polyps that we weren't otherwise able to see and remove them and prevent those polyps from growing into other important lesions. And then we've got over here specimen containers, workstation for the physicians, and all of the trappings that we would need to take care of any happenings that come up. The other great thing about this site that they don't have at the other sites, at least not yet, is this really unique boom system. So if you'll notice, everything is actually off of the ground. All the wires are through the boom system here and not on the ground. So much safer and easier to travel around and work around in this space. And the screen is actually on an arm that is rotatable around the entire patient, because depending on the procedure that we're doing, we want the screen in different positions, and we're able to do that very easily with this setup. And all 3 rooms are fitted the same way. So that's that. The only other thing I will show you is, of course, after we use the scopes, we need to clean them. And previously what we needed to do is actually take the scope out of the room, walk it all the way around the hall, take it to the endoscopy cleaning room where there's personnel that clean them. This setup allows us to do that with the use of the door. It goes directly through to the cleaning unit, and all 3 rooms have access to this through this nifty little door. So, a little noisy, sorry about that. So this is an endoscope, and as you'll see, it's a flexible piece of equipment. It's actually very expensive as well and high-tech. At the end of it, there's a light source. I haven't got it turned on right now, but there's a light source and a fiber optic camera. This one is actually for the upper GI tract, so it's called a gastroscope. The lower GI tract is assessed typically with a colonoscope, which is larger and longer because that part of the bowel is longer. These instruments allow us to very carefully and very in a detailed manner inspect the GI tract. So we can use this particular instrument to have a look at the esophagus, stomach, and first part of the small bowel, looking for different types of lesions, including celiac disease, peptic ulcers, polyps or masses in the upper GI tract, or evidence of reflux or other types of inflammation in the esophagus. And we can actually not only make diagnoses, but provide therapy for through the scope as well by stopping gastrointestinal bleeds, for instance, or removing polyps and taking biopsies. That's the gastroscope. The colonoscope does a similar type of function, obviously for the lower GI tract. We use it predominantly to assess that area, to look for diseases such as inflammatory bowel disease, Crohn's, and ulcerative colitis. but also to look for other important disease states, colon cancers, polyps, which is really important in the colon cancer screening program. And that instrument also allows us to take biopsies and, of course, remove the polyps and send them off for analysis. So those are the major procedures that we do here. There are a minority of procedures that are done in these endoscopy rooms that have nothing to do with the GI tract. For instance, we do bronchoscopy, so upper respiratory tract inspections as well. And I have special colleagues, 2 colleagues here at Dartmouth General that provide that service. And then there are a couple of urologists as well who spend some of their time in the suites here doing urologic procedures. But the bulk of the procedures done here are done by gastroenterologists and general surgeons using either a gastroscope or a colonoscope.